So 3, 2, 1. Over to you, sir.
Hello everyone, this is Dr. Himanshu Padh. I've done my MD from BJ Medical College, Ahmedabad. I am an FACC and I am a practicing physician in the city of Jamnagar, Gujarat state for the last 25 years. Today we'll be speaking on the dissolution technique in the Telmisartan formulation. Telmisartan is an angiotensin receptor blocker, ARB, approved for the treatment of hypertension. The mechanism of telmisartan is that it binds to the AT1 receptors with high affinity, causing inhibition of the action of angiotensin 2 on vascular smooth muscle, ultimately leading to a reduction in the arterial blood pressure. The solubility of telmisartan in aqueous solutions is strongly pH dependent, with maximum solubility observed at high and low pH. It is seen that different brands of telmisartan may not produce equally desirable clinical effects at the same dose, and this variability in therapeutic response is one of the problems with telmisartan. Different factors responsible for this therapeutic response are highly variable. Pharmacokinetic properties like excessive first-pass metabolism, low solubility, and high permeability as BCS class 2 drug, the presence of food, use of excipient, diluent, lubricants, etc. contribute to it. It has been seen that absolute bioavailability of telmisartan is about 42% at 40 milligrams and 57% at 160 milligrams. The solubility in aqueous solutions is strongly pH dependent, with maximum solubility observed at high and low pH. Now, poor solubility results in low bioavailability. After ingestion, the tablet undergoes disintegration and dissolution before being absorbed, rate and extent of which into the systemic circulation determine its bioavailability. The solubility or dissolution behavior of a drug is key determinant to its oral bioavailability, rate limiting to drug absorption. Poor solubility results in low bioavailability, leading to large inter and intra-subject variation and large variations in blood drug concentrations versus the fasting conditions. If the drug does not dissolve readily or cannot penetrate the epithelial membrane, time at the absorption may be insufficient. Bioavailability tends to be highly variable and low. With any oral preparation, drug dissolution profiles may be distinct due to differences in formulations and manufacturing processes. As mentioned earlier, because of variable therapeutic response seen with various brands of telmisartan and the unique pharmacokinetic properties of telmisartan, comparison of dissolution profiles and other parameters of generic telmisartan brands with that of the innovator brand is required. Various methods used by manufacturer to overcome low bioavailability and improve dissolution of a poorly water-soluble drug is by formation of solid dispersion with hydrophilic polymer, polyvinyl, pyrrolidone, and other diverse carriers, and the use of alkalizer. Sodium hydroxide is considered as a strong alkalizer, and it provides maximum solubility of telmisartan. Some of the generic and innovator brand contains sodium hydroxide, and it creates a microenvironmental pH around telmisartan granules and thus enhances the solubility of telmisartan in the interstitial fluid. Unique technology is used by companies wherein micronized telmisartan granules, primarily mixed with suitable alkalizer, sodium hydroxide, an open-level 2-arm randomized parallel study conducted to assess the bioavailability of telmisartan tablet formulation in 18 healthy male volunteers. Telmisartan peak plasma concentration is achieved within 30 minutes of oral administration, and Tmax is 1 hour. The dissolution medium selected is pH 7.5 phosphate buffer, which is a media specified for telmisartan tablet as per FDA OGD guidelines. USP requires not less than 75% of the labeled amount dissolved within 30 minutes. The dissolution of more than 80% of the drug should be released within 1 hour is following the pharmacopoeial specifications. Compared with Micardis, the innovator brand, Telista has shown 96.68% of drug release as compared to 94.68% of the innovator brand. So to get the features of Telmisartan dissolution profile, sodium hydroxide is a strong base used to dissolve as the drug is soluble in strong base. Alkalizer used for improving dissolution profile in Telmisartan tablet is as per innovator brand Telmisartan. The dissolution medium selected is pH 7.5 phosphate buffer, which is a media specified for Telmisartan tablet as per FDA ODG guidelines. USP requires not less than 70% of the labeled amount dissolved within 30 minutes. pH 7.5 is the recommended buffer pH in the United States Pharmacopoeia. Development of dissolution method was validated accordance with ICH guidelines because providing the method is experimentally sound, yielding precise, accurate, and repeatable results. Thank you very much for a silent hearing. Thank you.